Now I say to men, you've got a couple of parts of your body that are very tender. I want you to think about compressing those tender parts of your body with 44 pounds of weight. And of course they cringe and they cross their legs and their hands come over their body but isn't that about the same, right? Would any man subject himself to a manogram or a testogram and have his tender body parts compressed and radiated? No, it wouldn't happen. It would never happen. Why are we doing it as women?
Do you think that many women had a mastectomy or lumpectomy, that I need to tell you in common words, they cut the breast unnecessarily?
Well, that has been our experience. So there are women that are being overdiagnosed through the use of mammograms and not necessarily ultrasounds and MRIs, but I would think through mammograms that are being diagnosed with calcifications or DCIS, ductal carcinoma in situ, and that which has been reclassified, and they've taken the word carcinoma out of that, but women are still having mastectomies. They're having chemo and radiation for something that essentially is not breast cancer that they could have for the rest of their lives, that would not impact them in a negative way. It's the intervention that is impacting their lives negatively. Philip?
And let me say this, the president of the American Cancer Society addressed this last year and said we need a better definition of cancer, and we are overdiagnosing and overtreating cancers that would otherwise not affect a woman, much less kill her.
People are so disconnected from themselves. They are giving their power away left and right, and letting people make decisions about their life from their health standpoint, from every standpoint. And so they need to take responsibility for that and know that innately they have the answers inside of them. And they just need to be still enough to hear that, to listen, and to know that they'll be guided and led in the right direction. And they have to do whatever they can to stop listening to the fear mongers, even if it's their family members. So if they need to step away or whatever they need to do so that they can get quiet and get back in touch with who they are and the essence of their being and their health, that's what they have to do. That is priority number one.
Why is thermography not covered under most insurance plans while mammography is covered?
This becomes a matter of insurance politics. There was one study done in the 1980s to validate thermography, and the study was so terribly flawed that it wasn't reproducible. And based upon that one study in the 1980s, the insurance industry came to the conclusion that thermography didn't work. And so despite the validation from the American Medical Association, despite the approval from the FDA, despite comments made by reputable sources about the validity of thermography and the waning faith in mammography, the insurance companies still call it experimental. And when you send them documentation from the FDA and the AMA that clearly state in so many words that it is not experimental, that it is beyond the experimental stage, their answer is, well, for us it's experimental. The good news is that with more and more women being more and more awakened based upon knowledge and information coming from the internet, more and more insurance companies are starting to recognize that they're going to have to pay for this test. And so whereas 5 years ago the reimbursement was virtually nil, at this point in time the reimbursement from most insurance companies is about 30% of the carriers are reimbursing some of the clientele, some of the patients. And that's a big step forward considering where we were. And we're hoping that as more and more women look to this and as more and more literature comes out, we're going to have more and more reimbursement for the women and make it one of the mainstays of cancer, pre-cancer, breast health diagnosis.
I mean, in the scheme of things, thermography is very, very inexpensive. You know, like save your Starbucks money for a week and you can afford a thermogram, or, you know, so you've got to have your priorities in order as to what you want, where you want to put your money. And if it means saving your life or saving the life of your daughter or your child, then that makes sense to me. It's money well spent.